I want to be a dentist since I was 9 years old. And my mother, she had a toothache, miserable toothache, and then she went to see a doctor, came back, and I realized I want to be the person who fixed my mother.
I've been with Dr. Suh since, I believe, 2005. My husband is a patient here. My granddaughter will be a patient here soon, and I feel I'm in very good hands. And I trust what Dr. Suh tells me as far as the work that needs to be done.
He's a warm person, but he's professional. He knows what his business is. And he's always up to date on the newest procedures.
Our office is really driven by quality. It's not so much a quick fix. So I always educate our patients, and my staff educate our patient to how to keep the one set of teeth that we all have.
He's taught me how to brush my teeth the proper way, the way to keep cleanings down to a minimum. My dental work is doing great now because of his expertise.
I was on the 1960 and the 1964 Olympic water polo teams, and then continued to play masters after that. I've had my teeth knocked out from playing water polo. When these got knocked out or halfway chipped, a dentist did the first caps, but he made them a little bit longer than the rest of my teeth. So when Dr. Suh first saw me, he goes, "Oh, hey, that's not even. We need to take care of that." Well, okay, and he did. He did a great job.
Bedside manner, or in this case, chair-side manner, is something that's very important to me. And I get that here with Dr. Suh. With the staff, I feel like I'm part of the family, and I feel like they're part of my family. He helps me with my comfort level, because I don't like, even today, going to the dentist.
I was a dental chicken for many, many years. I was one of those that didn't want to come to the dentist and didn't do the cleaning. I was very bad about it. I had an extraction done about 6 months ago. If you're going to get an extraction, come to Dr. Suh, because totally pain-free. And the rest of his procedures, again, my root canal and the crown, I was very comfortable. I was made comfortable from beginning to end.
I knew he was from the Navy, and I have a fondness for the Navy because I'm a Navy family.
Upon graduation from dental school, I went the naval officer as a dental officer. It happens to be that Desert Storm, the war came on, and so I was based on aircraft carrier, and I was in Kuwait to be a triage officer. But triage means actually when the casualty comes in, I'm the one who has to go out, identify different types of injuries, and that's how I send them to the appropriate locations. In order to become a triage officer, so it taught me a lot of medical aspects. I was able to do a surgery like sinus lift, which I do now, complicated extractions. Those things that I learned from the naval career, it helps me during private practice.
He has a big heart, and he gives a lot of his time to other nations and people.
He travels worldwide to people that, that don't have access to dentistry.
He goes to the Middle East and teaches dentists there about new and improved techniques for dentistry.
Because of my previous experience during the war, I do want to reach out those people who really need some hope, either through my hands or through my lectures. But there's out there that could use a little bit of hope from all of us.
He cares about people, and you can tell it in his staff. And when you come, you just feel like you're coming to see family. And when you come out, your smile's brighter.
He's one of a kind. He has adopted me, and I have adopted him. He is my son, and I'm his mom. And it surprises anybody that happens to be in the office. I don't know, we have a chemistry. That's very unusual, and we just set one another off laughing. And we're just good friends. Plus, he's my dentist.
It makes me feel good from my standpoint of going to a dentist to be able to share that with my friends, to tell them someone that I am very satisfied with the work that he's done for me and can give the name out so they can also get good service also.
I can't recommend him high enough. He's just great. I don't trust anybody else with my mouth.
I don't care where I am. If I move to Alaska, I'm coming back down here to get my teeth taken care of.
They treat you like family. He will explain everything to you from the very beginning until you have a full understanding, and he won't do anything until you're comfortable with that.
So I want people to know that when you come to visit our office, it is truly quality driven, and that they're going to learn something each and every appointment they come in. We care, and we truly do care about their health.